allow me to speak in English. So we stage cancer based on the size of the tissue we get, the size of the tumor itself. We also know that cancer can spread into what we call the lymph nodes. I think lymph nodes are everywhere in the body, but the quickest way to demonstrate is the ones that swell when you have a tonsillitis. So there are many across the body, and sometimes we also look at the lymph nodes and if the tumor has gone into the lymph nodes. And then we also determine how far the tumor has moved from the primary site. So, for example, if someone had, for example, a stomach cancer, which ideally should be in the abdomen, and we find those types of cancers in the brain, then we know it has moved far, and we use the term metastasis. But that is what we call TNM staging, and that is one of the ways we classify tumors. But the other staging we use is stage 1, 2, 3, and 4. So stage 1, and I think we've had the warriors talk about that. So stage 1 is when the cancer cells are within the primary place where they are found. So, for example, when you have a breast cancer, if the cancerous cells are breast cells, which have changed to become cancerous, then we'll call that stage 1. It has not yet moved to the nearby tissues. Now, the breast tissue sits on muscle, it sits on bone, and, the spinal cord is there behind the breast tissue. So if it begins to spread to the nearby cells, then we categorize it stage 2 or 3, and we have multiple reasons for doing that. We even use imaging and all of that. But we then call it stage 4 when it has moved distant from the primary site. So, for example, if we find breast cancer cells in the lungs, then we'll call it stage 4. It's a complex thing. We use the first way we diagnose is, number one, you talk to the patient. You need to understand what is the history, what has happened, like the warriors mentioned, family. We then also examine the patient. We have to see, we visualize, is there bleeding, is there pus, is there some clear fluid coming out, and there are modifications to this. And then we'll always also do imaging to collaborate all of this. And then finally, we'll work with the surgeons. It's usually a multidisciplinary team approach, where we work with the surgeons who then is able to cut off a piece of this tissue. And then it comes to us, the pathologists, where we use a machine called the microscope, where we put it on a tissue and we look under, and we're literally able to tell.
Asante daktari. Tutarudi kwako baadaye uweze kutuarifu wakati inapofika uamuzi unatolewa kwamba sehemu fulani ya mwili iondolewe kwa sababu ya saratani.